Thank you, Mark. I'm really looking forward to today's forum and want to welcome our speaker home to First Church. Lianna is a member here, and if I remember correctly, you served on Jennifer's search committee. So we can express our gratitude for her for that service, as well as the wonderful work that she's doing, which we'll hear about here today. When I went to a Milwaukee film presentation, I heard about an innovative program to address poverty and found out that the Zilber Family Foundation is running a program here in Milwaukee. So I called, and lo and behold, found out that Lianna had been promoted to executive director. And Lianna's parents are in the audience, and son, and I know are very proud of Lianna. So with that said, let me just welcome Lianna, and let's hear about the Zilber Family Foundation.
Thank you, Bruce. Well, hi everybody, thanks for coming today. I'm excited to share a little bit more about the Zilber Family Foundation. The foundation was founded by Joseph and Vera Zilber, two Milwaukee natives, and Joe Zilber built, do you want that to happen? Yeah.
Yeah.
Okay.
Are you okay with that? Or?
No, that's fine. I just wanted to make sure that everything was working as you wanted it to. But Joe and Vera Zilber are Milwaukee natives. And Joe built a very successful real estate development company, which is now called Zilber Limited. And at the end of his life, he decided he wanted to donate the wealth and the fruits from that business to start the Zilber Family, or to the Zilber Family Foundation. So he wrote a book called How I Built an Empire and Gave It Away. And the work of the foundation is living out his vision of helping individuals, neighborhoods, and communities thrive. So today, how are we living out that vision? Our mission is to increase access to social and economic opportunity, really helping meet the needs of people living in poverty through grant investments to nonprofit organizations, really to help create and promote improved economic stability and quality of life. At the end of the day, Joe cared about people. He cared about the people in his company. He cared about the people in his community. He grew up in Lindsay Heights, which is a neighborhood in the 53206 zip code, and wanted to be able to give back to revitalization efforts. We have invested in places where the Zilber family has called home. That means Milwaukee, and specifically these three neighborhoods, Lindsay Heights on the north side, Clark Square, and Layton Boulevard West on the south side. We also make grant investments in Hawaii, on Oahu, where the Zilber family lives and where Joe lived at the end of his life. But really focusing on these three neighborhoods in Milwaukee was initially part of the Zilber Neighborhood Initiative, where in 2008, we chose three neighborhoods to build quality of life plans that were all resident driven, to be able to invest in projects, priorities, and initiatives that the residents uplifted as important to their neighborhood. So we continue working in those geographies today. So these four buckets are really around issues that we fund. I'll touch on all of them briefly, but then I'll dig into our work around economic stability, specifically the work around the Bridge Project. So we fund basic needs. We fund programs that support homeless services, substance use treatment, mental health, family and domestic violence support. We know that to have economic stability, we also have to meet people where they are, and create a strong social safety net. We are also really invested with our nonprofit partners in helping their organizations be strong, efficient, and effective. So just like you would make an investment in a business to do research, to have leadership development, to build capacity, we make those investments in our nonprofit organizations as well. We provide organizational and strengthening support to help make their organizations as strong as they can be to be able to continue delivering on their services. And then we also fund and continue to fund the projects that Joe and Vera held really closely to their hearts and initiated in their lifetimes. The UWM Zilber College of Public Health, the Zilber Family Hospice, and the Castle Vera Zilber Birth Center, which is in Hawaii. So you can see that we fund across the lifespan, birth to death. So economic stability, at the end of the day, we're really interested in helping people have and create the financial resources that help meet their basic needs, but ultimately that support their family. And I mentioned the Zilber Neighborhood Initiative. It was a 10-year initiative started in 2008, and we extended that work another 5 years just recently here until 2024-25. And what we learned across that time was it's really important to continue funding nonprofit organizations, but what would happen if we also gave money to people? Because at the end of the day, the hypothesis would be that money helps solve poverty. Cash in people's pockets can make a true impact in somebody's life. And so this work around how can we help people create and live out stable lives is really focused on our work around safe and affordable housing and then access to cash and capital. So a year ago, April 2024, we announced our partnership with the Bridge Project, but the work leading up to that was really to help answer that question around what would it look like if we gave resources directly to people. Many of you may have heard work around universal basic income, guaranteed income, basic income. Those are all terms in this space around unconditional cash transfers. So the Bridge Project was founded in 2021 during the pandemic, and the founders had a social service agency and were working with specifically moms. And what she was finding was people need diapers, people need to pay their rent, people need to take care of their kids. And while they were providing services, she was asking herself the question, well, what they need is money right now. They need to pay phone bills, utility bills, keep the lights on. So that was how the Bridge Project was born.
Wasn't it started in New York City?
It was started in New York City. So as we were looking across the country at programs, there's a number of different pilots and programs across the country around guaranteed income. We found the Bridge Project, which is based in New York, started in New York City in 2021, and they provide unconditional cash transfers to moms and babies for the first 3 years of that baby's life. And I guess I'll just say the difference between terminology. So universal basic income is the premise that everybody, all residents would receive sort of that income floor. Everybody would receive those recurring payments. The difference between unconditional cash transfers or guaranteed income is that it's targeted for a specific population. So in this case, the Bridge Project works with pregnant moms and babies, and is what we're hoping is a scalable solution to economic stability and child poverty in Milwaukee. The Bridge Project now has grown to be the largest consistent unconditional cash program for moms and babies in the nation. It provides low-income moms with bi-weekly cash transfers during their pregnancy, the birth of their child, and then 3 years following the child's life. And what they found is that this helps promote healthy development and break intergenerational cycles of poverty. So their model is pretty simple. They work with local foundations or philanthropic groups in cities. Milwaukee was the first expansion site outside of New York City, which was really exciting for us to help build their expansion model. They work with local community-based organizations. There's a lottery for moms to apply, and then soon after they're accepted, they start receiving payments in the third trimester of their pregnancy. And the reason that the Bridge Project was so special and intriguing to us was really because they hold these three core beliefs. They really invest in prevention versus undoing effects later in life. If we can help a mom and a baby find some stability and strength in those early days, what could that mean for that child's life? They also have rooted this program in research and in evidence that this is a really efficient program, that we don't have to overly complicate or require burdensome reporting, but this program really can make a difference. And then at the core of this program and many guaranteed income programs or cash transfer programs is that dignity is paramount. So what giving cash to people does is it trusts you to know what best to do with that money. I know that I need to buy a crib for my baby. I know that this week my rent is due, and there's not restrictions on that cash or strings attached to that money. So really trusting moms to make the decisions that are best for their family. So a little bit by the numbers, the Bridge Project is now in 2025 serving 3,000 babies across the country. They operate in 6 states. I mentioned Milwaukee was the first expansion site, and they are working with partners every day to continue to expand. The average household income of a participant is about $17,000. I'll touch on the Milwaukee data in a little bit, but this is across all of their programs. The average age is 26, and $65 million has been committed to date. The Bridge Project was founded and it continues to be supported by a New York-based foundation called the Monarch Foundation. And the Monarch Foundation covers all overhead and staff costs so that when a local foundation decides they want to participate or start a program, all of the Zilber Family Foundation's funds are going directly to moms in Milwaukee. And so I said earlier, they were really interested in understanding the impact of their program early on. And so from that first cohort in 2021, they started to see some of that early impact. And first and foremost, they saw a 240% increase in savings after just 6 months in the program. What that does is provide a safety net for families so that when an emergency does come up, when you have an unexpected doctor's visit or a transportation need, that you have some cushion there to be able to address it. They also saw over 60% increase in the ability to find stable housing. People were able to work more by having this recurring cash transfer for 3 years. They were able to move into a full or part-time capacity after at least 18 months in the program. And then something that they found that wasn't part of their early hypotheses was that they saw an increase in about 2.5 months of breastfeeding for moms. So giving moms time to bond with their child after the birth of their child, often particularly low-income moms are, nobody gives, we don't have a nationwide parental leave benefit, but often low-income moms bear that burden because there is no paid or leave policy. And this quote at the top is, I thought, really powerful. This program allowed me to stay home during the week to study, take care of my baby, and go to nursing school during the weekend. I'm almost done and hope to make better money in the future. It was a massive blessing. So she was unemployed at the time that she entered the program, and exiting is going to be, have a nursing degree and be able to find full-time employment. So in Milwaukee, we worked with the Bridge Project to create some very basic parameters for moms to be able to apply and ultimately join the program. There's just 4 criteria. We ask that moms be 18 years or older, be 23 weeks pregnant or less, which really allows for that first payment to be distributed during their 3rd trimester. There's a one-time prenatal stipend as well. And then live in the zip codes of our priority neighborhoods. The neighborhoods that the Zilber Family Foundation is primarily funded in. And then have an annual household income of less than $39,000. And so over those 3 years of the program, moms receive just under $20,000 across those 3 years. It's distributed a little bit differently. We also, there's a note at the bottom here, we don't ask for Social Security number or immigration status of any kind, so really the application is pretty simple. It checks through these 4 boxes, and then there's a verification process that the Bridge team completes, and then there was a lottery. So the program in Milwaukee initially started with 100 moms, which was funded by the Zilber Family Foundation, and we've since been able to expand that to serve 122 moms with the support of a private anonymous donor and the City of Milwaukee. The City of Milwaukee committed some ARPA funds to be able to fund, or to make that program a 3-year program. We initially started it with 2 years. And so what do we see in the impacts for our moms in Milwaukee? Initially, what the Bridge Project team shared with us is that financial hardship is prevalent, as 94% of participants struggle to afford basic needs, and over 40% could not afford a $400 emergency expense. Now, having been in the program for almost a year, it'll be a year in June, there's some really promising bright spots. 48% of moms were able to increase their savings, many seeing an increase to over $500. We've heard some amazing stories and been able to see some photos of moms and their babies now, that really what this allows moms to do is have some of that stress be relieved, to be able to take a deep breath and figure out what's next. This quote is from a Milwaukee participant who says, "I doubled my income. I joined a special education master's program at UW-Madison, and I'm now a special education teacher resident who gets teacher pay while working and going to school." So really, this program has allowed her to invest in her education and invest in her family, and really give her a buffer to take care of herself and her family during a really, what can be a really stressful time. We also learned that, I shared a little bit, that the average income of participants nationwide is about $17,000. In Milwaukee, it's about $8,000.
Wow.
And so what we've talked to the Bridge Project about is for highlighting really the chronic and persistent poverty that folks in Milwaukee are facing, really highlighting the importance for a program like this. They shared that they're working in Appalachia, and the poverty level of participants in the Milwaukee program is even more severe, which really hit us as the funder of this program, but for all of us to know that just the crushing weight of poverty in our community, and how programs like this and giving people some space to breathe is just highlighting the importance of that. I think I'll stop here and just open it up for questions. If you're interested in having a dialogue about the Bridge Project or the Zilber Family Foundation, sure.
Do I need a mic?
I'll repeat it. I can repeat the question.
So I've been interested in these programs for a while. I know like one of the early ones was the one in Stockton, California, right? And I know St. Paul is doing a lot in this, and they've partnered with a researcher at Michigan State University to study the results, and they're doing a randomized controlled trial dividing folks into 3 groups. And so I've kind of got 2 questions. So one is, how are you tracking the data and results? It sounds like you've got a good way of doing that. And also I know that St. Paul's program is also looking at contributions to their Universal Child Savings Account program, which of course Wisconsin doesn't have yet. And Milwaukee used to have in the Fund My Future Milwaukee program, but that isn't current. So just curious if there's any plans to combine this with something like Universal Child Savings Account program for saving for post-secondary education, and also about how the results are being tracked.
Yeah, 2 great questions. I'll just repeat them just so that the people watching can also hear. So how is the program being tracked? What sort of data collection methods or research institutions are we working with? And then are we looking at pairing this with something like baby bonds or an investment to increase savings for the baby or child? On the research side, so the Bridge Project has partnered with the University of Pennsylvania's Center for Guaranteed Income Research, and they set up their initial program with that randomized control study. And so they were conducting that work initially with their first cohort, and now have brought an internal research team to be able to understand impact of the programs across the country. We decided in Milwaukee that we had done extensive research on the effects of guaranteed income and direct cash transfers, and we're confident in how the Bridge Project's research methods were set up. So we didn't add any additional research component to the study. They are conducting, as you saw from those initial data points or stories, the impact. It's optional for moms to participate because it's a no strings attached program. We don't say, here's your monthly cash, now answer these research questions for us. If they choose to answer the questions, there is a stipend that they receive for their time, and that is how we are getting some of this information. But the majority of folks are interested in participating because I think they understand too that they're interested in understanding how this is working. On the question of vehicles to pair this with, like potentially baby bonds or Milwaukee's early program, it's something that the Zilber Family Foundation is interested in as we build out that work around increasing access to cash and capital. We're starting in a couple ways to see, how it works and how it's going, but it's definitely something that we're interested in and figuring out.
Thanks. I also just realized I misspoke that St. Paul's partnering with University of Michigan, not Michigan State.
Bruce.
Do you provide some counseling or other support to the mothers, whether it be on clearing up credit or other issues and questions?
It's a great question, and it's one that we talked about a lot early on when we were thinking about the program in Milwaukee. The Bridge Project team has a team that works directly with moms in the program. So they do the check-ins with them, they help connect them to resources. Again, everything is optional, so if somebody says, I don't need or want to participate in any of that, they don't need to. But they're not caseworkers, but they're resource connectors through the Bridge Project team is able to connect people to those programs. But there aren't any requirements to say you have to participate in financial literacy or education. You have to take these classes. There are options to do that, and we've worked with some local partners to be able to provide those programs, but it's all at the will of participants.
seems like working with partners is useful. I saw on the website there's staff of 5, I think you've got, or 6 at the foundation, and with 122 moms, that's a lot of work.
Well, and so we, to clarify, the foundation, the Zilber Family Foundation, made a grant investment to the Bridge Project. And so the Bridge Project is the implementing partner and runs the program. They're based in New York, so it's a virtual connection, but we don't work directly with participants. We basically provided the funding for this program to launch here. Yeah.
Yes, I'm wondering if you engage the followers of all of this program. If you do, how does that work?
There's some programs that specifically, do we engage fathers in the program at all, and how does that work? Again, it's through sort of those connections to partner organizations or services that are providing those resources. There's some programs at the City of Milwaukee. There are some other nonprofit organizations that specifically focus on fatherhood initiatives, but this program is really focused on mom and baby.
I'm assuming this is nothing like the kind of scale that's going to make a real dent in poverty. That it's a great thing. You're doing research is important. So I'm just wondering if you thought at all about the politics of it. We used to have AFDC, and in the 90s, the illustrious President Clinton made a deal to get rid of cash payments to people, right, which probably gave them stability. Is there any thought about the politics of this and how to take it to a real scale where it makes a serious difference in poverty levels?
Yeah, I mean, the expanded child tax credit during the pandemic cut child poverty in half, which was really at scale the largest policy initiative that we've seen, like programs like this. That has now, not continued, and I know our partners at the Bridge Project are engaged in advocacy and efforts to continue to promote efforts like the expanded child tax credit. But yes, I mean, it's guaranteed income, universal basic income, unconditional cash transfers, has a long history of being bipartisan because of the effects that it has and the impact that it has. It has not continued in that way and has become a more partisan issue. And so continuing to share the impacts, the stories, I think to bring that issue closer to the center of, what impact can we have in terms of poverty alleviation will be important. But right now, at least in Milwaukee, we're starting here to say, how does this work for Milwaukee? What are the impacts? And then looking a little bit further to policy implications.
My concern is with living poisoning, and I'm not exactly sure how to phrase this question, but I'm wondering if this program provides resources to people, to education. I know it's a severe problem in the zip codes that you serve. Do you provide awareness, education, linkage to other places? What do you do?
Yeah, I would say, so part of this work in the economic stability for the foundation is around this access to cash and capital. The other pillar is safe and affordable housing. And so we work with partners, nonprofit organizations in that space, many who are working to address that issue. So an organization, the aging housing stock in Milwaukee is a big part of the lead issue. And so organizations that are providing critical repairs or property improvement, they are making, they are part of our grantee partners. But it's a massive issue. We've funded things like water filters, we've funded the critical repair piece, But it's a really big systems issue, and we see it right now with the Milwaukee Public Schools and the schools that have are really challenged with lead poisoning, and with the cuts and the federal funding landscape, and not even federal funding, but just the federal landscape right now with the CDC not being able to provide resources. I know our health commissioner doesn't have a connection anymore to the CDC, and so some of those national connections and resources that used to be able to help address local issues like lead in Milwaukee are just no longer there. So it's actually something that we need to figure out quickly and in collaboration, because
How has the closing of SDC affected what you're doing?
I mean, the loss of those programs is startling, and really, was an anchor and provided services to many of the people and organizations in neighborhoods that we work with. So figuring out how to fill that void is also a high priority. So also thinking about what other partners in the space can help fill some of those gaps.
Just following up on an earlier question, thinking of, and also prevention is worth a pound of cure. Do you have any kind of rough figures or estimates about how effective it is to invest at the level that you're talking about here, in terms of what it would cost for healthcare problems later on, or issues with funding, supporting people in jails, et cetera, et cetera, et cetera. And also kind of thinking in terms of Pope Francis and the help to just in terms of the spiritual context. Yes.
Excuse me, before you answer, George, it looks like the microphone is picking up the questions.
It's actually picking up really well through the Zoom session too, so no need to repeat.
Okay, great.
The first question was around investing early and the effects, sort of return on investment versus more upstream investments versus fixes on the other side. There is some really compelling data specifically around for moms and babies around that return, that social return on investment. I don't have the figures off the top of my head, but we know that if moms have resources, and I will also say this program also works to connect them to healthcare if they're not already. We worked with the state of Wisconsin, and this is maybe another policy comment, to secure benefit waivers for participants. So other benefits that they may be receiving, like SNAP or WIC, energy assistance. The state of Wisconsin has said receiving more income will not affect those benefits. We were hoping for sort of a net increase here. Often the conversation around the benefits cliff to say the more income you make then precludes you from receiving other benefits, and so you actually are de-incentivized in some ways to raise your income because you won't be receiving support. That's an aside to say that Medicaid, there's been some research around Medicaid utilization, and if moms don't have access to resources or healthcare, actually emergency room visits go up because that's the primary way that individuals access healthcare if they're not connected to other providers. So that's one example, but the Bridge Project is really interested in understanding longitudinal effects of programs like this. They started in 2021, and so this program specifically is in the early days, but there are some other pilots across the country that are looking at longitudinal effects.
What does longitudinal mean?
Long term, so thinking, this program for moms is 3 years. And the research around it currently would be around, okay, when you enter the program, this is the state, and then when you exit, this is sort of the result. Thinking about that in a longer time span of 10 plus years to say, this was the impact on that child. Did that child, was that child able to not move 10 times because they had stable housing, which allowed them to have greater educational outcomes, or as an example. We don't know that yet, that's the hope and the hypothesis, but we are not looking at that long-term span at this time, at least in Milwaukee, although I know there are aspirations too. And then the second question was around the Pope and the spiritual component. Are you asking philosophically or like for participants, what kind of care is provided?
I'm just thinking, particularly since the Pope's funeral was yesterday, and what an incredible spokesperson, I think no matter what religious tradition people are from, for the poor and people in poverty and immigrants and so on and so on. That this is, in that spirit, it seems like what you're dealing with here is trying to put that spirit into practice in some ways.
Yeah, I mean, the definition of philanthropy is care of humanity. And so I think we at the Zilber Family Foundation aim to live that out, and that is expressed through our grants and our partners that are doing the work every day. I think at our core, that's our mission, is to care for people and to improve quality of life for people. That's the spirit of our founder. And I'll also just mention, like, Joe Zilber, Mr. Zilber, was an incredibly successful businessman, but was incredibly entrepreneurial and was willing to take risks, was willing to admit when something didn't work. He, would have said he had a number of business opportunities that didn't work, and he didn't see that as failure. He saw that as willingness to ask the next question and to take the next step. And so we try to live that out as well. I think a lot of people early on when we were talking about a program like unconditional cash transfers in Milwaukee, there was a lot of question around what's the risk if it doesn't work, this is the first of this kind in Milwaukee. And for us, I don't think we really saw it as risk, because when you invest in people, when you care for people, and you do so with the type of care and love that programs like the Bridge Project provide participants, we all win. And so, caring for the least among us, I think, is in our charter. And, maybe Pope Francis's funeral or words were able to highlight some of that.
When I told a friend about this program, his immediate response was, "Oh, giving somebody some money for nothing? I'm not in favor of that." I'm sure you run into that lots, whether it's political or in other ways. What's your response to comments like that?
Yeah, there are a lot of common tropes that, as well as, not providing restrictions on what people can spend it on. And I think the first response is just, that's not what the data shows. And so we know now from many studies, from hundreds of pilots, that people spend this money on their basic needs, on housing, utilities, caring for their family. And so the evidence just doesn't show that people are using it for nefarious causes, or this is a lifeline. And it is an investment or a leap of faith and trust in people, but that also honors that dignity and agency of people. I think I would also ask for programs or services or resources that you may take advantage of. What things do we all do that are more inherent versus earned? And what determines when something's earned? There are systems of disinvestment that have led to chronic poverty in our city. And so to say that it's an individual's fault or problem or to individualize it without looking at systems, I think is that first step to say, we have responsibility. We are all responsible for caring for each other. But there are, that tends to be response. What the impact shows, what the data shows, what participants say is counter to that. So I think I just lean on those responses as highlighting the impact.
Sounds very Unitarian. You must be living a dream job.
Yes, yeah, I am.
Bruce had mentioned that he learned about this film, which we also attended, which was a documentary on the Bridge Project, which was really eye-opening for me. Is that available to view online or someplace?
So it's a documentary called It's Basic, is I think the one that you're referring to. It wasn't just on the Bridge Project, it was on programs like the one in the Twin Cities that highlighted programs across the country. It's actually available at some libraries, so I just checked, you can, I think it's called Canopy, there's an app, so you, depending on your public library system, you could access it through there. We've talked about potentially doing another showing or making it available, but it's a really powerful look at people across the spectrum in many different cities and how they're using unconditional cash. Go ahead.
Following up on Bruce's question and statement, it seems like one thing I would be concerned about in terms of just giving money and not being used well might be if they were like drug addiction, that they would be concerned, oh, it's just going to help support the habit. Is there any screening done in that regard?
No, really the criteria that you saw is the criteria. There are some programs that are focused on specific populations. For example, there's some programs that are focused specifically on people experiencing homelessness, for individuals who do have substance use issues, that there are programs specifically focused on those populations, but we didn't have any screening other than the criteria that you saw. And while that may be, a very small case, like what we see writ large and what the data from the Bridge Project shows is that folks are really using these funds to care for their families. Mark?
How many, people how many people are rejected in the lottery?
It's a great question. I don't know the final numbers, but initially there were over 800 applications for those first 100 spots. And so the need greatly outweighs what we were able to provide in this first program. We are interested in continuing beyond this first pilot. We're interested in talking to other funders, other individuals. I mentioned there was a private anonymous donor that heard about this program and said, we want to support that. We needed to be able to have a program to be able to talk to people about. So we're interested in understanding, is there, from other foundations, other philanthropists, would they be interested in continuing to partner with us? But the need was overwhelming to the number of individual spots.
Brief comment on that question. One, I really appreciate that Zilber is following science that we have now and not some traditional work on that, and so all this money can go to the provision as possible. Second question is also kind of on administration and how you were able to disseminate information about that this resource is available to the population in most need. I work in social services too, and it's always like how do we get to the most disconnected families, and so like opposing a library, that's to go to a library, that kind of thing. So like, what was your process there?
I didn't mention this, I don't think early about the Zilber Family Foundation, but our grant making is annually about 15 to 19 million, and we work with about 100 nonprofit organizations. Before we announced applications were open, specifically talked to our nonprofit partners about specifically ones that work in the neighborhoods that we serve and that may work, across populations that this relates to say, if you know someone, make a personal invitation, sit with them and fill out an application. We held a couple of in-person, so the applications were online. We held a couple of in-person sessions with trusted partners to say, we'll have an iPad available. Somebody will be there to guide you through it. But we leaned on our community partners. We did a community webinar before the launch, and partners like the City of Milwaukee, the Health Department, they have a number of programs that serve new moms and babies to be able to share that program with their doula program or other birth workers to be able to share that information. We started there and then did a blast of applications are open, but we relied on those community partnerships.
It sounds like your approach to housing really works on the individual side more than on the supply side of building housing. Joe Zilber was a real estate guy. Is there any thought of trying to move into more of the development side? Either maybe, 18 to 19 million dollars is a lot of money, but a drop in the bucket when you talk about developing housing. Just wondering what your thinking is about that side of things.
So on that safe and affordable housing bucket, there's a couple of different ways that we work to address supply and new construction. We were talking about like the aging housing stock in Milwaukee, and so new construction has been identified by the Community Development Alliance, the CDA, so a number of agencies across the city came together to develop the collective affordable housing plan. And so that plan identifies 4 priorities to be able to close the gap between Black and brown homeownership and white homeownership. We are losing thousands of homeowners every year if we don't continue to focus on increasing supply and critical repairs, predatory investors. And so the Zilber Family Foundation has made a number of grants in organizations and nonprofit developers who are building new construction, in the Community Development Alliance who are working on those 4 strategies to promote racial equity in homeownership, and organizations like VIA, CDC, Habitat for Humanity, Milwaukee Christian Center are all building new houses, new development. And so our grant investments in the housing space are directed in that way.
Well, thank you very much, Lianna, for coming. It's 11 o'clock, so time for the 11 o'clock service. Can you stick around if people want to, or maybe you want to go? No, you've got Aldo and
I'll stick around for a couple minutes.
Yeah, okay. Thank you again.
Thanks.